Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined once more by brother Stephen.
Hello, Michael.
We're rolling back into this.
Okay.
I don't know. I'm so inconsistent in publishing these now. I apologize to all of our listeners out there that we're really setting their clock by getting the Family Pet Podcast episodes every Thursday morning. Now they're every occasional Thursday morning and sometimes Saturday and sometimes Monday.
We'll get better.
I think it's because I'm getting older and sometimes I forget.
That is a symptom of aging.
Also,
I hear.
Also, I have trouble sometimes walking to the podcast studio to do my editing because I have plantar fasciitis now. It has been almost a year that I've been dealing with this.
I've heard far more about your feet than that I care to admit.
I have a special sock now that I wear, and I feel so ridiculous. But the sock, thanks to our brother David, he told me wear this sock, and it has like Velcro on it, and it's like it holds my foot in a certain position, so
Does it keep your toes all
yes,
tight?
it keeps my toes
Yeah.
backwards.
My dad.
Strange.
And it has made such a big difference. I'll update everyone. Maybe in the next month I can be better.
Lose the sock.
Family Pet Podcast.
That's right. So, health concerns as you get older, it's a real thing.
It is. Yes.
I haven't had any surgeries because of my age, unlike you.
I'm not sure I had it because of my age. I blame our mother for.
Oh,
Genetics.
I would never do that.
Yeah, well, it was because my brothers had the same. Our brothers had the same surgery, and he's 7 years younger, or 8 years younger.
We're joined by a young, vibrant doctor today who can't share in these painful aging struggles, but she's here to talk to us about aging with our pets. We have Dr. Christine Garrett back on the podcast. I don't remember exactly what episode it was, but
You've been on twice before, or is it even more?
Twice. This is my third time.
Third time.
Ooh,
Okay.
that's saying something. That's like you
Senior
and Pat
or
Johnson Bennett.
You're in rare. That's right.
We're gonna get like we have to get something special for 5-timers, like they do on Saturday Night Live. When you host 5 times on Saturday Night Live, they get you a
the
jacket.
blazer.
Yeah, we'll do something here. Let us know, listeners, what should we get our 5-time guest? But we're happy to have you back, Dr. Garrett.
Thank you. Yeah, I'm glad to be back with y'all.
Today we're talking about aging in our pets today.
Yes, sir.
But specifically, if listeners remember, you work for Antech Diagnostics.
I do. Yes, full disclosure.
Yeah.
I do work for a diagnostics company, so I have a lot of investment in the health of pets, especially the senior and geriatric ones.
And as we talk today, we're going to be talking about testing, some of the things that we can test. So Antech, as you said, in full disclosure, is the reason you come is because we're clients of y'all. So we do all of our in-house and reference testing with Antech Diagnostic. We've had a great relationship over 8 years? Almost 7.
2018.
Yeah, I don't even know what year that is.
Do your math. It's 7.
That's 7 coming up on 7 years.
It's hard at any age.
That's right. It's again, I'm getting old and it's hard. I have people for that now.
People. Okay.
Well, Dr. Garrett's one of our people. So when we called her back and said, hey, you're coming today to talk to our team here at the vet office about how to talk to and educate our clients in the exam room about blood work testing. Mm-hmm. And we're going to get to it. You've got some new things to share with us today.
Ooh, I do.
Right. And
for a second there, I thought you looked surprised.
Yeah, like,
I do. Wait, what?
Let me check my notes. What am I talking? No. We've got some exciting stuff.
Well, there's some terms that I think we should start with. It's a good place to start. We have I've heard people say old pets. My dog is an old dog. Or they might say my dog is a senior dog or geriatric. What the heck are the differences between those terms?
Yeah, for sure. So it can be kind of confusing, definitely. And I have, as y'all know, a 14-year-old dog, since she's in her silver years these days.
Oh, silver years.
Silver years. That's another term. Yeah. So just to confuse things even more. Right. But typically it's going to be based on how many years or how old they are. And then we also have to take into consideration some breed differences and feline versus canine differences as well. Okay. So if you want some kind of basic guidelines for dogs, 7 to 10 years old is going to be senior. And then 11 and up is geriatric. For cats, it's 9 to 13 is senior. And then 14 is over. And over is considered geriatric. For dogs, though, we do have to be a little bit careful when we start putting ages on our large breed dogs and then our toy breeds, because there are going to be some variability there. So kind of keeping that in mind as well.
And that variability is that the smaller dog general lifespan is longer.
Tends to be longer. Yeah. And our large breed dogs tend to age a bit faster, if you will. So
I think we did we cover these? Well, I think we did cover these.
Crystal did that.
That's who it was.
Chronologically in the order of our podcast episodes, it was only like 2 episodes ago, but chronologically in time frame, it was months ago.
Right. Yeah. Sorry, folks. I'll try to do better, but I'm making no promises. My New Year's resolution is I'm not making any resolutions.
I resolve to not be resolved. I'm unresolved for 2025.
Exactly. Well,
a lot of parents have seen online, though, it's about a year for every 7 years. And when we talk about lab work and stuff, that's kind of like a general idea. So every year of our life is like 7 for one of our pets.
Stephen, that calculates you're getting to be a senior.
Well, I thought you were going to say calculating that Maverick and I are about the same age now.
Oh,
but next year he will chronologically catch me.
He gets the AARP for pets
for dogs
discounts.
Stephen got those
steep discounts.
he is 6 right now. So next year when he turns 7, he will almost catch me. And then
so our listeners may find that their veterinary offices have, from the time that their dog or cat comes home, so they start off with puppy exams or kitten wellness exams, and then it's just a yearly annual wellness exam, and then around, like at Family Pet Health, around year 7, that's when it says senior wellness exam. So what are our doctors, what are our veterinarians looking for differently in a senior wellness exam versus what people may have experienced as a puppy or kitten exam?
Sure. Yeah. Our needs change over time, right?
Right.
This is not the same for a puppy or a kitten or a young child versus someone in their silver years of life. So as pets age, it's the same kind of thing as with people too. We're more predisposed to getting certain conditions. And there are a couple of studies that actually looked at these senior and geriatric age categories in cats and dogs. And they were like, exactly, okay, what's more prevalent? What are people maybe not seeing in their own pets at home that a veterinary exam and blood work might actually be able to pick up on? And the most common things in dogs were things like orthopedic disease. So coming in and we don't know that our pets are slow, or we kind of know our pets are slowing down maybe, but like, why is that actually happening? Maybe it's arthritis, maybe it's something like a torn ACL, but things that veterinarians can diagnose on a physical exam. So that was a really common one. Renal disease or kidney disease, liver disease, hepatic disease, that gets into that blood work. We really need to have that blood work to have those values. It's not something we can see on physical exam. Dental disease was a really common one as well. So those things that we don't necessarily know when we're just looking at our dogs, we're like, I think they look okay.
Right.
But over time, these things change. Like our dogs and cats don't brush their teeth every day, even if we try our best. They have dental disease, and that's one of the big ones as well.
So really, it's a combination of a physical exam with the lab work.
Absolutely.
So we tell people that the lab work here is the inside. It's the exam for the insides. So our doctors put their hands on the pet's exterior, but we can't, to get a good look on what's going on the inside with the organs and systems, they have to do the blood work.
Absolutely. And that's something I talk about with veterinary practices all the time too. Our diagnostics that we provide at Antech are only as good as what happens in that exam room. So physical exam, the history, and really pet parents bring concerns to their veterinary team too. What's going on with your dog at home? How have things changed over time? Let's have this conversation.
So one of the things on our history form that we send to clients, it breaks down the category. If we talk about a dog, obviously you got puppy questions for puppies. You've got a adult dog, which again we defined as that 1 to 8 years old kind of situation. Then we have senior pet questions, and it asks some of those mobility. But I was thinking about weight changes.
Metabolism.
Tell us.
Are we all concerned? What can we do?
Make me feel better that my dog is going through the same thing.
So metabolism changes over time, right? So there are a lot of different formulations for dog and cat foods because we know that metabolism will slow as pets age, and those things that also develop with age won't be any better if that pet is overweight. So things like arthritis, right? It's really going to be hard for that pet to manage their arthritis if they're also overweight and they have mobility challenges for multiple reasons. So keeping a really healthy ideal weight is going to be critical. Cats and dogs. I see a lot of overweight cats out there, and it's just like, we love our pets with food, but truly they will have a longer, healthier life if we maintain a healthy body weight.
My dog Maverick was in Friday. Again, 6-year-old German Shepherd. He had a hot spot, so he's got allergy issues that are developing. Great, but I've been bragging with Dr. Sam that Maverick has the same weight. He's had the same weight for 4 years. He is right at 61 pounds. He weighs 64, and he's put on 4 pounds since July when he was in for his most recent. And I'm like, oh,
we're trending. We're trending up.
Me too, Maverick. Me too.
Oh no. But I kind of said, well, part of it is we're not as active in the fall because that's my soccer season, and so I don't have as much time for him. But winter, ironically, is when we exercise more. We spend more time outside.
Nice.
He loves it. It's like,
he's ready
20 degrees. It feels great to me.
4 pounds is a lot for a percentage of his weight
in 5 months.
Yeah.
I was shocked.
Putting on another 20 pounds.
So
I need to lose 20 pounds.
What that illustrated to me, though, is, again, that happened in a 4 to 5 month window. We talk about biannual exams once a pet gets a certain age, especially important. Is that one of the reasons why things like senior issues can sneak up really quickly?
Yeah, we've talked about, pets are aging faster than we really kind of comprehend. And that biannual exam is a great time to pick up on things like weight gain, rechecking some lab work, maybe even too. The changes just happen faster. So absolutely. When you said 4 to 5 months, I was like, okay, I'm glad he was in. I'm glad it was time. Yeah. Check that weight and always write it down.
Well, you can use the Pet Desk app, and it keeps up with all that for you.
Perfect.
Track that. All of our clients and listeners, you can download the Pet Desk app. I'm going to give them a free commercial here. That you can just go to your app store and download the Pet Desk app, and you can upload your pets, all your information. It'll be right there on your phone. For clients of ours, it will automatically have that because our systems talk to each other.
That's awesome.
It's a good way to track.
It's a chance to intervene too, right? So you have this information now, that over the holiday season, we're not going to give extra cookies. We're going to decrease that diet, that food intake by maybe 10%, 15% and get those 4 pounds off. Let's go.
You talked about,
I need you in my life to motivate me.
But we did, when we talk about the extra diagnostics, we did, Maverick does an annual that everything, because he doesnn't like needles. So I can't spread things out. So it's all on one visit. He gets his dental, he gets his annual, he gets all his vaccine. Poor dog is a big baby for 48 hours.
Car wash and yes, I want the tire and everything.
So we did, we have the blood work that we always do, but I added orthopedic radiographs this year. He has osteoarthritis, not showing symptoms, but it's there. And then next year, we already have on the agenda for April to do the eye testing that we talked about with Dr. Bergstrom.
The pressure test.
Yeah.
Good
job.
all
three, the tear pressure and what's the third test?
For an aging dog?
Well, for dogs, they have like 3.
Well, it's like a Schirmer tear test.
Schirmer tear,
for your tear test, and then
the pressure test.
And
I don't think he'd be getting stains for any kind of.
I think it was just a 2.
It was probably just a stain.
Was it a third one?
Yeah.
We'll have to go back and listen to our.
They'll probably actually be looking in, at his retina, his cornea, his lens, all the different layers, because dogs also have a lot of aging changes to their eyes, hearing loss. I just told y'all. Yeah. It's a big change that she's had, and she also has some visual issues as well. She's getting a dental. She had her orthopedic radiographs this morning in her lab work too. So she's kind of like Maverick.
That's what we're adding, the fast scan ultrasound. So
picking up on things earlier.
I have a question. I have heard it said that if we all live long enough, we all get cancer. Is that true? And is that true for our pets too? Is that more of a...
Unfortunately, I think the national average is about 6 million diagnoses of cancer every year in pets. So that's a really large number. And it's about 50% of dogs over the age of 10 that'll end up having some kind of cancer or neoplasia. There are lots of different ways to term it, but some kind of cancer. So it's very common. Yeah.
Have you had any yet?
Cancer?
Yeah.
No.
I think you would.
Well, I mean, I had cancer. I had the skin cancer.
Yeah.
I had the notch cut out of my neck.
Oh yeah, I forgot about that. No,
I forget about it all the
I
time.
also haven't gone to a primary. I have not had my annual exam late, so I just go to an endocrinologist. Anyway, so when it comes to cancer in our, is that something that we're looking at those biannual exams? We're looking for.
So there's a couple of ways to think about it, right? And I'm glad y'all brought this up because it's November. We're recording this in November.
Right.
Who knows when
We will publish in November.
It'll be published in November. Yeah. So November is actually National Pet Cancer Awareness Month. And it's a great time to talk about all kinds of diagnostics, but particularly those that can pick up on cancer in dogs. You got to start with your physical exam. We mentioned that already, right?
Mm-hmm.
So making sure your pets are going in, that they're being checked out for any lumps, bumps, or changes that an owner might actually pick up on. Those pet parents that are just petting their dogs are like, "Ooh, that's new."
Yeah.
Ask your veterinarian. Like, we're happy to take a look at those things and test them. But there are also some fun things that have come up in the last few years with blood work that we can actually pick up on certain types of cancer as well.
And that's what we're going to be announced. That kind of our lead in to the new testing and image. Tell us about what we have as it relates to.
There is something that
I'm going to mess it up.
Why are we here?
Tell us about what's new in cancer diagnostics.
Yes. So we now have a blood test for nucleosomes, and nucleosomes are something that's in every cell. So what happens with cancer is there's an increased rate of cellular turnover.
Mm-hmm.
So these cells are dying off, they're growing really rapidly. And as people think about cancer, they're like things that are growing, lumps, bumps, those kind of changes in their pets. Well, with cellular turnover and cellular die-off, this little tiny thing called a nucleosome gets released into the bloodstream. And we can actually measure that and pick it up on a blood sample now. That's great. And if a pet has a high level of these nucleosomes, as we call them, then that might be an indication that we should investigate further. Like doing your fast scans, that's a great example of a next step diagnostic for something we might want to do. Your veterinarian might also recommend something like a lymph node aspirate if they're concerned about something like lymphoma. On the fast scan, more like a liver tumor, a splenic tumor, those kind of things.
So when cells are rapidly changing and releasing and dividing, I guess, then when that process happens, they release nucleosomes into the bloodstream. And the new test is testing for those
nucleosomes.
Do we need to, like, at the very first senior pet exam, we just take is that part of is that an add-on or is it part of a regular senior pet?
It would be something to add on.
Okay.
So our traditional panels are still the same as they've been for quite a while. So we have a complete blood count that looks at white blood cells, red blood cells, platelets. That's kind of like the immune system function, or one way to measure it. On the chemistry panel, it's looking at liver function, kidney function, glucose, electrolytes. And for many years, we've been asking this question, or as a pet parent and as a veterinarian, I'm like, what can I do to test my dog for cancer? We can't test for specific cancers. What we can do is get a red flag and say, hey, this pet has elevated nucleosomes. We should probably go on a further diagnostic hunt for some kind of cancer.
Do we need to have a baseline of what is quote unquote normal for nucleosome levels in a dog or a cat, and so that we can compare it as the pet ages?
Yeah,
or is
that's
it just
possible?
Okay?
So the current studies have a population of normal dogs. So we know where normal dogs tend to sit with their nucleosome levels. And we're having studies done that are looking at monitoring over time for patients that have already been diagnosed with cancer. So how does it change in patients that are maybe receiving chemotherapy, radiation, surgical intervention for their different types of neoplasia? So there's a lot of potential for this particular test. But right now, what we know is that if we have an elevated nucleosome level in a pet that otherwise seems healthy, we need to be investigating further.
Are there issues with this test related to, you said, an otherwise healthy pet?
Yeah.
If my dog is in for, I don't know what, allergies or something, or vomiting. He's in here for vomiting, and we're going to do a blood panel because of this thing. Is that the time to do the add-on?
Probably not. We probably want to work up the vomiting. So did your dog eat a foreign body? Something like that. Was there a toxin ingestion? Thinking through a traditional diagnostic workup. And if we get to the end of that and we still don't have an answer, maybe we check a nucleosome level. Other things that can elevate a nucleosome level are things like sepsis or severe trauma. So we want that patient to be otherwise stable and quote unquote healthy appearing before we start reaching for a nucleosome or a NuQ test, as it's called, actually.
Okay.
Yeah.
So
NuQ.
even healthy cells release nucleosomes when they divide.
There's a normal cellular turnover in every body.
Okay.
And that's why we have that study that says this is where we expect normal healthy dogs to sit. And if we have an elevation, maybe it's like on our chemistry panel when we have liver values. If there's a mild increase, nobody's going to panic, right? We're going to investigate, we're going to monitor, and maybe even recheck that patient. Same thing with nucleosomes. We have that option to monitor and recheck. If it's markedly elevated, so it's super high, okay, this is when we're going to maybe be more active for that patient and actually do some diagnostics either same day or very soon.
And this technology is pretty new.
It is. It's been around for a couple of years.
Okay.
It's newer to Antech, and the opportunities are really endless with this test. It's kind of exciting. And it fills a gap that we haven't really had an answer for.
Right.
So it's giving us more information. It's moving in the right direction.
And there are certain breeds of dogs that are the owners of those particular dogs need to be more aware that this testing exists.
Yeah, we call them predisposed breed categories, and so there are some poster children or poster dogs for
poster pups.
Let me guess one. Let me guess one.
Yes,
French Bulldog.
French Bulldogs are on the list, actually. Yes, sir.
Golden Retrievers.
And they're the actual poster pup.
Wow.
Yeah, Golden Retrievers.
Yeah, dude. How many splenectomies have we done here? Come on.
We have
calling them out.
Yeah. Well, it's not that we do the volume of splenectomies. It's that they tend to be
Golden Retrievers.
That makes sense now.
Labs, German Shepherds. So
wait, huh?
Yeah. German Shepherds are on the list.
That pet insurance handy, buddy. Don't forget to pay that premium.
Okay.
So starting to think about this in dogs as they get into that senior and geriatric life stage. So for dogs over the age of 7, thinking about maybe making a nucleosome check a part of their annual. Okay. If they're a predisposed breed, so Golden Retrievers, like we mentioned, German Shepherds, maybe those dogs even a bit younger, somewhere around 4 years old.
Just going to add that to Maverick's
list. Maverick, we need you to bring an extra blood sample, please. Thank you.
Well, he'll be asleep because he won't let you draw it while he's awake.
No, he will not.
Is Maverick a German Shepherd? Okay. Understood.
And he's got big teeth that he likes to show when you show him the needle.
You have got to do more desensitization training, buddy.
Okay. You bring the needle and desensitize this dog. I like to keep my hands and fingers.
Y'all have an understanding.
He does not do needles. He loves everybody in this clinic until they bring out a needle. And then
well, the good news about this test is it is a small blood sample, so it's not something where we have to do anything real special. A standard blood draw, purple top tube that y'all have in this practice will do just fine.
Does this kind of testing exist in human medicine?
Yeah, I think they've looked at some nucleosome levels in humans as well. I don't think that's readily being used.
Right.
Cancer diagnostics are definitely something that's...
dogs get better medicine than the human in this regard?
Well, a lot of things start with dogs and move to humans.
Well, I mean, we talked a lot. Yeah. We talked a lot about the monoclonal antibodies, the anti-nerve growth factor monoclonal antibodies, which is... So that's stuff that's far more...
Can't wait to play that again on the slow. Go ahead.
So anyway.
Colonial.
Preventive.
Yes.
Yeah, I can say that word correctly.
Or is it preventative?
No, it's preventive. It's preventive.
That's the episode we need to go.
Yes,
that's right.
But I thought a lot of the technology moves from human down to the animal care because we talk about MRIs and CT scans.
I think acceptance does.
Right.
So owner or pet parent knowledge about diagnostics may come a lot from human medicine, and they're like, oh wait, we can do this for our dogs as well. But a lot of studies and things may actually start in veterinary patients and then become more readily available to humans too. So I think there's a lot of cross-pollination there.
This is the podcast for curious pet parents. So I think we have a very educated listenership. If they want to learn more, where can they go to find out more about the NuQ?
So you can literally Google it. NuQ is how it's spelled, which is that might help. So looking up NuQ, and the original product was put out by Heska. and Heska is now an Antech company. So all of that will be on the Antech site, and pet parents can find out more. But my first line recommendation is actually to talk to your veterinarian.
We love that advice.
Yeah.
That just
see if it applies to your pet. See if it's something that is going to be a recommendation for your pet's age, lifestyle, breed, everything. This test is specific for dogs. I will add that in. So our feline patients are still waiting for a cancer diagnostic or a cancer screening test of this kind. But I think this is, like I said earlier, a step in the right direction for all patients.
Awesome. I'm excited.
Yeah.
Wasn't even exactly where I was thinking we would go with this podcast, but it works.
We went around to it.
Yeah. I'm going to learn more about that. Will you'll be talking with our team about that today, I assume, right?
Yeah. So we're going to do some education with the team so that they feel comfortable talking to pet parents about it as well. And then we're going to do a little demo with Lady Chicken Gravy, my dog.
For those, I don't know if I guess nobody can see her. She's circling underneath the table for those viewers. We'll get her up, Dr. Garrett, get her up on the lap there. Maybe she's like, I'm not going to.
Non-cooperative.
Well, it is time. It is
sapper in the background.
Yes, there we go. She's gonna now, Lady Chicken Gravy. We need a fun fact for our listeners at home. This is something that will help our listeners win trivia night, or at least impress their friends and family at Thanksgiving dinner coming up. Dr. Garrett, what is your fun fact today?
This is a really good one.
Okay.
Did y'all know that hedgehogs are resistant to snake venom?
I did not know that.
Wait, how do the snakes even get them? Because
they have a very, very, very soft underbelly.
Okay.
They're going for the underbelly.
They're going for the underbelly.
But they are resistant to
snake venom. Now, super high doses are still going to cause a problem, but yeah. So not like our poor pups and cats.
So when you're walking your hedgehog through the woods in Middle Tennessee and it gets bit by a rattlesnake, it will laugh at you. Now you know. Yeah. Okay. You don't have to rush to the.
You don't have to worry about the boa squeezing. It's the quills.
That is true. Oh, there's a good fun fact for everybody out there.
Cool.
All right. Well, Dr. Garrett, thank you again for coming and speaking with us on the podcast. We'll do like on this big blue wall for those that are watching on our YouTube channel. Maybe you'll be the first 5-timer on the Hall of Fame.
I mean, I hope so.
Yep.
I would like a gold jacket as well. Maybe a mug.
Let's see what we can do.
Special mug to drink.
I'll have a Christmas ornament. We'll get you a new Christmas ornament.
I'm a big fan of Christmas ornaments.
Really?
That actually, I don't need the wall or the jacket or the mug. I just want the
Hey, we have the best Christmas ornaments. And if anybody out there is listening and you hear me talk about this, email us at info@familypethealth.com.
Well, I forgot what our it's the Family Pet Podcast at gmail.com.
Okay. So. Or just message us. We're easy to find. Yeah. We'll save you an ornament this year. The ornament. Should I tell everybody what the design? I should
tell us, and we'll see how many of our team actually listens.
0.
Yes.
Okay. It is a cutout of the state of Tennessee with the Family Pet Health logo in the middle of it.
Does it have the TriStar?
It does not have the TriStars in it because I didn't want the pressure on our designer to. I have a thing about upside down TriStars. It really bothers me.
Okay.
A lot.
I can see that.
2 stars up, folks, and slightly turned clockwise.
Bottom star aimed directly at the 6 o'clock.
The highest star should also be the closest to the flagpole.
Understood.
There you go.
Now I know.
There's another fun fact. Bonus fun fact. Well, we'll save you a Family Pet Christmas ornament.
Thank you.
Yeah. Well, for all of you listeners out there, we hope you've enjoyed this episode of the Family Pet Podcast. And until next time, stay curious.